When a person's heart stops beating and all their internal organs cease to function, we pronounce them dead. But what exactly lies beyond death? Does dying mean that's it? The complete end of our existence? Does the very essence of who we are simply vanish from this world the moment we die? Humanity has relentlessly sought to unravel the mysteries of death for centuries. However, because we cannot experience death firsthand and return to tell the tale, studying it from a purely scientific standpoint has proven to be an incredibly daunting task. Dr. Sam Parnia of NYU Langone Health, formerly at Stony Brook Medicine, is a specialist in intensive care and resuscitation who dedicates his research to the very threshold of death. In 2001, he conducted in-depth interviews with 63 patients who had miraculously survived after suffering cardiac arrest. 7 of these survivors retained vivid memories from after their heart stopped, and 4 testified to having what is known as a near-death experience, or NDE. In short, even though their hearts had stopped beating and they were considered medically dead, their consciousness remained remarkably active. A near-death experience is a phenomenon that occurs at the very brink of death. It encompasses extraordinary accounts that seemingly defy all logical explanation, such as traveling through a dark tunnel towards a brilliant light, having an out-of-body experience looking down at oneself and the surrounding room, or even reuniting with deceased loved ones. In the past, the mainstream scientific community dismissed these experiences as mere hallucinations triggered by a lack of oxygen to the brain. However, as modern medicine has advanced and the number of patients brought back from the brink of death has surged, we have reached a point where these accounts can no longer be definitively dismissed as simple tricks of the mind.
When our heart stops beating, blood circulation halts, cutting off the crucial oxygen supply to our vital organs. Ultimately, organ function ceases and death ensues. Astonishingly, however, even after the heart has stopped, the brain can survive and continue to function for roughly 6 more minutes. Research indicates that the cerebral cortex, in particular, the very center of memory, concentration, thought, language, and consciousness, remains remarkably alive and active.
To dig deeper into this mystery, Dr. Sam Parnia launched the landmark AWARE studies, one of the largest scientific investigations ever conducted on consciousness during cardiac arrest. In the first AWARE study, conducted in 2014, researchers followed over 2,060 cardiac arrest patients across multiple hospitals. Tragically, the vast majority could not be resuscitated. Only about 16% survived, and of those, only 140 survivors were able to participate in detailed interviews. What did they discover? While most patients had no memories of the event, a significant number reported some form of awareness during the period when their hearts had stopped. Among them, a small group described remarkably clear experiences, including seeing bright lights, feelings of peace, or even perceiving what was happening around them in the hospital room. Then came AWARE 2, published in 2023. This follow-up study went even further by incorporating brain monitoring during resuscitation. Among the interviewed survivors, 11 out of 28 reported memories or perceptions suggestive of consciousness while clinically dead. Some described transcendent experiences, while others recalled specific details from their resuscitation. Most strikingly, in one verified case, a patient accurately recalled conversations and events that occurred around them, even though they were in a state of cardiac arrest with no detectable heartbeat. Additionally, brainwave monitoring revealed surges of normal electrical activity consistent with consciousness, sometimes lasting up to 35 to 60 minutes into CPR. These findings challenge the long-held belief that the brain becomes completely inactive shortly after the heart stops. Instead, they suggest that human consciousness may persist longer than previously thought, even at the very edge of death. There is another remarkable case that sheds light on this phenomenon.
A team of neurosurgeons at the University of Louisville in Kentucky was conducting an electroencephalogram, or EEG, to treat a patient suffering from epilepsy. Tragically, during the procedure, the patient suffered a sudden and fatal cardiac arrest. As a result, the research team inadvertently recorded the patient's brain activity in the moments immediately preceding and following death. The data revealed a powerful surge in gamma brainwaves, the type associated with memory retrieval, occurring for 30 seconds before the heart stopped and continuing for 30 seconds after. In other words, in the fleeting moments bridging life and death, the patient likely experienced what is known as a life review, their entire life flashing before their eyes in a vivid panorama. Of course, because this data was gathered from a compromised brain affected by epilepsy, we cannot definitively assert that it applies universally to all of humanity. Nevertheless, it stands as an invaluable piece of scientific evidence, further substantiating that even after the heart ceases to beat, the brain remains remarkably alive and active. So, what does all of this actually mean? After seeing the surge of gamma waves in the Louisville study and the verified cases of awareness in the AWARE projects, we're forced to ask a fundamental question. If the brain can continue to show signs of consciousness even after the heart has stopped, can we truly say that a person is completely dead at that moment? This challenges our traditional medical definition of death. Under current standards, once the heart stops beating, a doctor declares the patient dead. But according to Dr. Parnia's research, that same patient might still be aware, possibly even hearing the doctor announce their time of death. This creates a profound gray area between life and death. Of course, these findings remain highly controversial. Many mainstream scientists criticize Dr. Parnia's work, arguing that the evidence is still too limited. Dr. Parnia himself admits that this field is still largely uncharted territory. After all, only a very small number of patients have shown clear signs of preserved consciousness. Most did not survive, making solid scientific data extremely difficult to obtain. Nevertheless, these studies force us to reconsider one of humanity's oldest questions. What is the true boundary between life and death? We may not have definitive answers yet, but one thing is certain. We need more large-scale, rigorous research to explore this mysterious frontier. But beyond the pursuit of scientific truth, these findings offer a profound resonance for how we live our lives. Perhaps death is not the cold, absolute severance we once believed it to be. What if, even after our hearts stop beating, our entire life unfolds before us in a vivid panorama and we can fully hear the final farewells of our loved ones standing by our side? Ultimately, this awakens us to two profound truths. First, that right now, in this very moment, we must live a life truly worthy of reflection when we eventually reach the threshold of death. And second, when guiding someone through their final moments, we must continue to offer warm words of comfort until the very second their consciousness finally fades. The final moments of life are a destination we must all inevitably reach. In that profound silence, may the memories that flash across your mind be filled not with regret, but with peaceful and beautiful moments. Knowledge delivered in just 5 minutes. That concludes today's episode of Flat Archive. Thank you for watching.